So legal issues can slow down productivity, but it doesn't need to stop it in any way, shape, or form. All right, so this is the real nitty-gritty here is the health informatics piece. The health informatics is really the foundation to how you're using information in healthcare. We are needing to have a good foundation so we can make a difference in patient outcomes. So right now you know about how many know about meaningful use? I don't want to make the assumption. Oh, not too many hands. Okay, so meaningful use is critical right now in all organizations. Whether you are working in a physician's office or you're working in an acute care setting, wherever you're working, meaningful use is essential because it affects the company's or organization's bottom line for reimbursement, okay, and incentive payments. Quality is about gathering the right information. Remember the first slide that talked about the essential versus non-essential? Well, this is where it hits the wall right here. If you're collecting information but it's not essential, is it going to help you with meaningful use? Meaningful use means this in a very basic way, that you can't just claim I'm using a computer and satisfy the requirements to get incentives back from the government. They're saying, well, I need to know that so many percentage of your patients, okay, are getting X education for X condition of all of your patients. And if that percentage doesn't meet this bottom minimum, you're not using your system meaningfully. Well, wow, meaningful use. This means that we have to be accountable, everyone, not just nurses, not just physicians, not just OT, PT, speech, whatever, but everyone must be accountable because they're looking at, are you really doing what you say you're doing? And this is how we find out, is through this meaningful use piece. So quality measures. So, all right, I'm going to take a little bit of a divergence here. Clinical decision support. How many people know about this? Okay, a few. All right, clinical decision support, there's kind of essentially two broad categories. One is expert, and one is just clinical decision support. Expert means that your system is designed so it will automatically tell you that a patient needs to have X if they have A. If they have A, they get X. That's expert. There's no choice unless there's, somebody overrides it. But traditionally, patient has A, they have diabetes, they have to have a glycoside A1C at a certain time point, okay? Which is a blood test to see how their sugar has been over the last 90 days. All right. Clinical decision support, your system is designed to give you pop-up recommendations. If your patient has X condition, you consider A, B, and C, and the clinician can make that decision on what they want to do, okay? With meaningful use criteria should be tied to these quality measures. If you tie your clinical decision support to quality measures, you will have meaningful use and you will find it in your systems. You will be able to find it in your systems. So health informatics is about the data, information, knowledge, wisdom, how to use it, how to improve care, how to improve outcomes. It is the catalyst. It is the catalyst for making a difference in patient care. And I venture to say that, well, let's see a show of hands. How many of you have known someone who has run into difficulties in their care within a healthcare organization or physician's office? Anybody? Okay? That's just, raise it again. Let's see. Oh, wow. You got about 50%. 50%. What does that tell you? It tells you something is amiss. Okay? So it's the information, and its applications that are an issue, and it may be the lack of technology or the technology that can be causing this, either way. Okay, so informatics is essential, and the use of health information technologies are essential for increasing the options for treatment. Why do you think this occurs? Can you make that link? All right, let me help you with it. If you have technology and you have access to information and you know how to use it, okay, you're going to have more options to select from. If you have been using a paper record and patient has X condition, how many databases do you have in a paper record to refer to for treatment options? How many? 0. It's like this. It's this. If you have 0, the only options that you have is the extent that your clinician has in their memory at that particular day, in that particular context. And if your clinician has a complicated day, how many things are they going to remember? Okay? So this right here, it increases the options for treatment. It reduces risks. Now, some people on the other side of this will say technologies can increase risk, and in some cases they can. So we can't be fooled. Don't be fooled by the technology. Don't do it. Don't do it. I'll give you an example, case in point. With information technologies, a medication sheet used by a prominent healthcare vendor, discharge sheet, it wasn't turned on, a patient got discharged with 3 like medications, hydrocodone, Percocet, and which one that's similar to that? Hydrocodone, Percocet, Narco. Okay, those are 3 very similar, right? Patient was discharged home with those 3 medications active on their list, all 3 being taken every 4 to 6 hours or more, at ranging from 5.0 milligrams to 7.5 milligrams. Now, this was in an electronic system, okay? So, the clinicians in here and students, what do you think the #1 danger is of those 3 meds being taken concurrently at those levels, every 4 to 6 hours? All right, so what?
Respiratory depression.
Respiratory depression. What's another one?
Constipation.
Well, constipation. Okay, good. All right. Very good. All right, so, but I want the one that's deadly, besides this one, acetaminophen. It'll kill your liver. This person was prescribed 6,000 milligrams a day because of the system and the output from that system. 6,000. What's going to happen to that man? How soon?
Soon.
One day. One day. So in our CHEETAH and what we do and how we are functioning with students and how we are partnering with others is to really take a hold and bring these issues out, to tease them out. To tease them out. Many clinicians have been in practice for quite some time. And if I started out with paper records, so this dates me. We used to do all paper records. How many other clinicians in here? Paper, oh, so it's still, okay, so I feel like I'm in good company. All right, started out with paper records. Unless you are involved in the HIT, clinicians may not really even know the potential that exists for them to improve what they see, what they get, how it's organized, and how it can be made sense of the data, okay? And that's where the health information technologies and the health informatics, they come together. They come together to help solve this space. It can help manage finances. Boy, You know, when you're talking about workload and you're talking about costs of things, supplies, materials, the costs of care, if we're finding redundancies, and we've done this together with our students and organizations, just looking at workflow, finding redundancies and creating new pathways, you can have an impact on their finances, done correctly. And most of all, and the most importantly of all, most important, is that impact on patient outcomes and that patient care. Well, the quagmire, yeah. So, I told you a lot today, haven't I? I brought in a lot of things. I brought in culture, I brought in technologies, I brought in the human factors piece, I brought in, we have clinicians, educators, consumers, and administrators. In the field of HIT and informatics, the space is huge. And you have the opportunity to come into that space in the area of your divine, let's see, divine interest. That's how big it is. You're not restricted. If you have a passion about one thing in healthcare, and you want to work with a clinician, and you want to work with an educator, and you want to work with a consumer, we can make that happen. Your university can make that happen for you. In any area of interest, I would venture to say. Don't you think?
I would.
Yes, in any area of interest. So the internet is, and the HITs bring in opportunities, but we also have to address the non-internet and non-technology users. We were having a conversation today. We are very forward-thinking in how can we get consumers engaged in healthcare. And there's a lot of cool things out there. I mean, I use a running program by Nike, and I'm not promoting them in any way, but you know, my daughter gives me challenges, and it sends me a little notice. So what do you think? Do you think I want to be second to my daughter? No, I'm going to walk. I don't run. I'm a walker. I'm a fast walker. Do you think that that makes a difference on what I do each and every day? Would it make a difference for you or you? There's a lot of technologies that are inspiring and engaging people to be creative ways to be healthier. But we have this space, and I want to tell you just a short story, and I know I'm running out of time, right? I'm getting there. So I'll be quick. My neighbor, 80, she passed away this past year. Her name is Betty. She was a wonderful woman. She was like a mother to me. My mother passed away when I was about 30, and she was just a kind person. She had some illnesses, and she went to the doctor and saw the doctor and went home, and then she called and wanted to make an appointment because she wasn't feeling so well. And the receptionist says, well, please send the email to the doctor. Please send an email to the doctor. She's in her 80s. They don't even have a computer. They use cell phones, but not connected to the internet. And she's going, I don't have that. What do I do? What am I going to do with this? How do I problem solve this? She says, well, I don't have the internet. Well, I guess I can take a message and call you back later. Well, how do you feel about this? How many of you know someone that is maybe over, I'm just going to pick a random number, let's say 55? 55 that do not use technology really to a really big extent. Oh, look at it. That's about 50%. 50%. So we're moving along at a fast pace, right? We're moving at a fast pace. And how are we going to keep those people engaged? And how do we get them information when they need it? And do you know that it's 50% now? And I venture to say I come back in a few years and it'll be much higher, okay? more people are going to be retiring, and just because they're a little bit younger doesn't mean that they all use technologies. They might use a phone. They might use a phone. But I don't know that they use a personal health record. I don't know that they're, oh, and that's a whole nother conversation. But anyway, this is another opportunity when we're working Cheetah with our students, with our partners. What are we doing about this? Do you think it's okay to just ignore it? What are the consequences of ignoring it? Name one consequence. One consequence. Do you want me to give you? Health disparities. The people that cost us the most money don't have access to the information that will help them reduce our costs. Okay? This is huge. It's very huge. Okay. Now, I'm a photographer as a hobbyist. And I'm going to use this example because I noticed that you have artwork out there that's gorgeous, and there's a photographer out there that's got black and white images, and I was looking at, and in fact, we've got some right in here. All of those images were created, but they give you a focus. And in healthcare, regardless of your interest or interests, you need to focus. Okay, you can't be all things. You can't do all things as much as you'd like to. It's kind of like going into a store. A child goes into a store, candy store, and says, "Oh, I want this. Give me this. Give me this. Give me this." Okay. Well, we really have to be very careful, and we work with our students. We work with our partners and collaborators. What is the focus? And not just be splashing around in the water, because splashing doesn't do much good. But we need to focus. We need to have an intentional focus. Just like in the images that you see here, it focuses you to a certain point. And while we may have multiple foci, we may have multiple projects, each project must have a very good, tight focus. And as students, when you're working in this healthcare space and you're wanting to do projects and work with organizations, you need to listen to what the vendor or the organization's focus is and be there with them. Oh, and then this one. I'm sure that most of you are aware of this right now. How many of you know somebody who seeks information about a problem that they're having, a health issue, or a disease on the internet? Okay, I heard somebody's going to self-diagnose himself, right? Okay, all right. Hey, we're having a little transition here where you've got some lines that are blurring between the expert and the peer resources. This is pretty difficult because people can get into situations where they may be doing things that may not be the best for themselves because all of a sudden they have information and may not interpret it or use it as well as they should. And so resources is we really need to be cognizant, whether we're working as a center or in our research or with students and our partners, is what are the resources that we're advocating for? What are they? And do they have some critical criterion that we're using to say, hey, you can trust this information? How many people know something about Health on the Net? Health on the Net, if you are not aware of it, gives you principles and guidance for the use of website evaluating websites. Highly recommended for professionals and for consumers. So that would be very helpful to you as well. And we teach students about this and so forth. So I'm almost done. I've only got 2 more slides, so just hang with me, okay? 2 slides. We're almost done, okay? So I want to talk about partnerships a little bit here. How do we establish partnerships? Well, it's through activities like we had today. Getting to know you. We have to get to know you. People need to get to know us. We have to build what? What do you suppose we need to build? Relationships, yes. Relationships. We also have to know ourselves first. If we don't know what we can really do first, it's really going to be difficult for us to partner with somebody. So we have to know ourselves first. We have to get to know others, to get to know you through building relationships. First things first. That way we can see where our differences and similarities are. If we always work with people who are exactly similar to us, will we make as much progress as we would if we work with people who are different from us? It's through differences. If one organization or partner has different strengths than us, are we going to go further that way than if we all carry the same? You betcha. We're going to go much further if we can bring the diversity, the differences, and the similarities together. We need to invest, okay, and this is about sharing. The willingness to share shows trust, okay? Keeping information from people who need the information is counterproductive and demonstrates kind of a lack of confidence and fear. Be willing to share. I'm willing to share when I don't know something. Like, I am not an expert in the genomics area. I am not ashamed to say that I don't have expertise there. That isn't my area. I'm good with that. I'm okay with it. And be willing to share what you do know. Like, I know quite a bit about similarity and how it can be used in the informatics realm and how it can be used in healthcare. And I would love to share that with you. And build that using the data and information that comes from the healthcare space. That is one of the things I really love. Sometimes in competitive markets in Kalamazoo we have 2 hospitals and sometimes they compete. Well, but there are other times that they throw that competition away. They let it go. And they work together and accomplish huge things. You've had that experience here, haven't you? Yes. Partner with your competition and you can make progress too. That's really important. And you influence and affect who? The community. It's usually the community. It can be as individual as patient, but you're talking really globally about community. So create and innovate. If you can come together, you be willing, sharing, trusting, have a bigger goal in mind, you can create and innovate. And this is where profound differences happen in healthcare. This is how some of the things like the HIEs, health information exchanges, have occurred through throwing this competition aside and saying, hey, we're going to work together and so forth. And it does make a difference in our world. And then celebrate your success. Sometimes we forget to celebrate, but even in the HI space, health informatics, HI space, when we're working with others, even small gains are a cause to celebrate. They really are. And the relationships, I am going to refocus on the relationships. The relationships are the foundation of building meaningfully in healthcare. Attention to that is very important. I have to keep current, knowing that we can't know all technologies. We cannot be experts in all technologies, but we do need to keep abreast of things that are changing as much as possible, knowing that the HI space is so huge. You're going to have people that pick different parts. That's okay. All right, their knowledge might be different from yours. Doesn't mean that they aren't okay. It just means that they have a different knowledge space that they're attending to. So actionable ideas is to create joint leadership and discovery groups. And this is where you have thinkers that are coming together, people who have passion about something. I'd like somebody to just raise their hand. What are you passionate about? What is your name? Diane, what are you passionate about?
Patient care.
Patient care. Anybody else passionate about patient care? Okay, I'll raise your hand. Okay, leadership and building leadership and discovery groups is finding people with passion and working with people that have passion from other places. They can be internally discovered, and they can be a mix of internal and external. It can include faculty, students, practicing clinicians, and so forth. Don't limit yourself. Consumers should be in here too, especially now that meaningful use is so important and patient engagement is right up there just as important as meaningful use. Having consumers in that leadership group is vital. And so we have established collaborative research projects. So, for example, I had a colleague that called me from University of Michigan just the other day, said, hey, I read your article on similarity and communication and how people see things differently and then how they also record it differently and categorize it differently. Is this a health informatics issue? You bet. They said, okay, well, I'm interested in physician-nurse communication. How come we see things so differently? Can I use similarity theory to do it? I said, well, you certainly can. Well, will you work with me? Yes, I will. And that's how it starts. Being willing. Reaching out. Somebody reached out to me. I reach out to others. But it's a fabulous thing because you know something good's going to come from it. So it will turn into a research project. We plan on doing it on paper, and it'll be done by September. So we already have we've had one conversation, we've already got goals. So that's how it is. It's finding your passion, finding other people with passion, making sure that you have good groups that are productive groups, not that you are invested. Did I even put that down here earlier? Did I put invest yourself earlier? Invest, invest, invest. Yep. Invest yourself. Okay? We have to strengthen academic and community-based partnerships. We are doing that. CHITA, that's the Center for Health Information Technology Advancement. We are doing that on a daily basis. We are working towards that. Part of our function here today is doing just that, strengthening a relationship that we have. This is one of my personal philosophies. Be unsatisfied. Okay, or dissatisfied. Okay? Dissatisfied would probably be better, but I'd be unsatisfied with the status quo. I generally, if you're not creating a little bit of tension somehow, in some way, maybe you're not pushing quite as much as you could. It feels uncomfortable sometimes to change things. It feels very uncomfortable. So, if you're always feeling satisfied and everybody around you is feeling satisfied and you're not getting any, then I'd say push a little bit more. See what you can do more to bring out better outcomes and better relationships with people. Build bridges between people, cultures, and differing perspectives. This goes back to, if I'm always with somebody who thinks just like me, am I always going to think just the way that I do? Yes. But if I get with somebody who thinks differently from me, then it broadens my world, and I'm going to be able to take in and understand more. And that's one of the challenges. Whether you're in informatics, whether you're in HIT, whether you're in nursing, or any of the other disciplines, part of really establishing leadership, collaborative research projects, strengthening our relationships means exploring people who are a little different than us. All right, so I have this question slide, but I want to give 5 minutes. Are we almost out of time? Oh, okay. All right. Any questions?
I know some students have to take off, they have classes, and are probably right at that last few minutes. We totally understand that. The Wasoric Center is really grateful to Dr. Bernie Hahn and Dr. Sharie Falan for presenting today for all of us.